much my energy.
Tits up real life. Yeah, when I see my picture, make a press like straight G-Wagon and an X5. Might pull up in a Model S, right? Tesla, living my best life. Yeah, I might pull up in a Maserati, maybe the Bugatti.
Ghetto Kids. Fantastic. Ladies and gentlemen, a round of applause for our... Ladies and gentlemen, yeah. A round of applause for our Ghetto Kids. Haza, when I was younger, I take these opportunities. I had dreams. DJ, are you ready? I am a ghetto kid. Come. We are going to dance. DJ Kona, you bring, Kosatia. Yeah. Thank you so much. Manange, asasura check yongezam. Round of applause. Thank you so much for Ghetto Kids. Well done. The age, how old is the youngest?
For me?
7.
So the youngest is 7 and the oldest is how old?
16.
16. Okay, I still qualify. So 7 to 16. Who here still qualifies? No? Me, I qualify. I turned 16 in December. 15th, send me gifts. All right. Before we start the officialities, I told you I'm the vibe. We're going to have a good time. I'm going to have all of us please rise to your feet and play a small game just to break the ice. You're a bit too serious in the morning, and I want us to, get into the award ceremony. So if we could all please rise, don't worry. It's a very simple exercise. There's no up and down. Just one down, yeah? So I'm going to say a few things. And do you promise to tell the truth? The whole truth and nothing but the truth? Okay. So if I say something and it's true to you, you sit down, okay? Yeah? For example, if I say, if your mother is Somali and your father is from Burundi, you can sit. You sit. We are together? Okay. Let's go. Test run. Let's see. Okay. If your name, your first name, starts with the letter M, like Malaika, take a seat. Michael, Maka, Melissa, Magdalena, everyone. Please, Musunguzi, stay standing. Mwesigwa, if I see you seated, I said first name. Okay. We're going. Next one. If you can speak 5 different international languages. Not in Uganda. Okay, fine. Let me include Uganda. If you can speak 5 different languages. Lango, Acholi, maybe Runyankore, Luganda. I will come and do a test. I've seen you, sir. I'm coming. Okay. If you did in your A-level, if you did history, economics, and geography, sit. You're in the wrong place. Wow. Okay. If you're here and you are wearing yellow socks, take a seat. Pull up those trousers and I see. All right. This one is mostly for the ladies. If the hair on your head is yours, it grew out from here. Not braids, not what? Kale. Gentlemen, if you have that connecting beard, take a seat. Hey. That beard, all right. If you have spectacles, take a seat. I knew half the room. Banange, doctors, you have suffered. You're the ones who treat us, but musiba in glasses. All right, we have a few people still standing. Okay, if this is your very first her event, take a seat. Very first. It's your first time. You're going to have a good time. And if it's your 6th He/Her event, take a seat. Then, if you're happy to be here, take a seat. Photographers, you want your money? Where are you standing? All right. Good afternoon, ladies and gentlemen. How are you doing? Allow me to reintroduce myself. My name again is Malaika. Yes, it's my real name. It's on my ID, my birth certificate. My parents knew what they were doing. They are bright. Now, today we're going to be celebrating individuals, organizations, institutions who are pioneering when it comes to self-care and sustainable healthcare models in Uganda. This is the Heroes in Health Awards, the 6th edition. Welcome. I hope that you're happy to be here. We are going to be absolutely entertained, but more so inspired by the stories that will be shared today, alongside the, maybe there's a lot of trials and tribulations that are happening, but that's when strength is truly seen and appreciated the most. It is in those tough times. I want to take this opportunity to invite our very first speaker for the welcome remarks. That is the Director General of Health Services, Ministry of Health in Uganda, Dr. Charles Olaro. While Dr. Charles Olaro makes his way, I'm reminded of some of the special words that was spoken today earlier, especially from Honorable Dr. Ruth Aceng, when she said Africa is not waiting for rescue. We're not just lying around and waiting. And events such as this show you exactly that. In fact, even the speaker from Kenya said, when the roots are deep, there is no need to fear the wind. I thought that was very, very powerful. With the deep roots that we have, we're welcoming could we please welcome our special guest for today, our guest of honor. A round of applause for our guest of honor. Let's kindly welcome our guest of honor. I know we did it earlier, but he had stepped out and he's back again. Okay, so I'm going to do this again. Honorable Speaker, Honorable, and all the delegates we have, all the protocol that was observed, I'm following it from above. I would like to let you know that my name is Malaika. I was born in Kenya, but I am Ugandan. And it's good to have you here, sir. So right now, this session is a little different from what you saw earlier. Aha, I like exactly how you sat back. That's exactly what this session is about. We're going to be taking a sit back, enjoy. You see that tie, eh? Relax, it's okay. It's no longer tight. We're going to be honoring the heroes in health here in Uganda. And since this is the 6th edition, usually they say by the time the child is 6 years old, we should add another child. And I know there's something in the works. So I also want to let you know that we're going to be recognizing all these individuals that inspire us to do more in the midst of everything that's going on in the industry, in the sector. They have fought and they have strived and they've gone forward and they've made it happen. Now, for also my people, you need to know these awards are not simple. It's not just here, smile, take a picture. No, no, no. One thing we like is when not only do you tell me, I wish you all the best, but you also ask me, Eleta Manyachi, correct? Correct? In my language, that means what name does it bring on the phone? So I can send you money. Hey. These awards will have a monetary value attached to them as well. So a round of applause for that. Nominees, now you really want the award. Huh? I want all the nominees, if the nominees could please stand and just wave to everyone so they can know our nominees are in the presence. I know you're in the back right there. Our nominees, stand and wave. Those are our nominees for today. The different individuals, institutions, and organizations. I would like to welcome, yet again, all protocol observed, the Director General of Health Services, Ministry of Health in Uganda, Dr. Charles Olaro. A round of applause for him as he makes his way. A big thank you to the Ministry of Health for making this happen. Mic check. It's okay? Microphone is okay.
Thank you. Our guest, the Right Honorable Amason King, the Speaker of the Senate of the Republic of Kenya, the Right Honorable Thomas Thieba, the Deputy Speaker of the Parliament of Uganda, the Honorable Minister, Your Excellencies, Permanent Secretary, government officials, distinguished guests, all development partners, healthcare professionals, the award nominees and the winners, the award judges, ladies and gentlemen. As I've been introduced, my name is Dr. Olaro Charles. I'm the Director General. I want to usher you into the 6 Heroes in Health Awards, and welcome once again. My minister always says that if you want to clap, you clap very hard. I'm truly glad to be here tonight, not just as the Director General of Health Services, but as someone who has walked alongside many of you in the trenches of the health care system. This evening is about honoring the people who keep the system alive. We often talk about systems, policies, frameworks, but tonight it's all about the people. It's about that midwife who stays past her shift for a mother when there's a mother in labor who needs labor, who's supposed to deliver. The village health team member who walks miles to deliver medicine, and to the innovator who builds a solution with nothing but just a laptop and a dream. Those are the heroes who are here to celebrate. Let's clap for them. This year's theme is strengthening health systems, empowering communities through self-care and sustainable solutions. It speaks to the reality that we can't ignore. We are facing tight budgets, shifting donor priorities, and more frequent emergencies. But we're also seeing something very powerful, that communities are stepping up. People are taking charge of their own health. And as a Director General, I'm quite very pleased. If you looked at the magazine of the summit, you find that most of it is really speaking into the subject where we are here, is aspect of self-care. Self-care is not just a buzzword. It reduces the burden on our health facilities. It improves access, and it ensures continuity of care even in emergencies. It's a cost-effective, it's scalable, but also it's sustainable. And most importantly, it places the power of health in the hands of the people. And I want to start with the people who are in this house, that self-care is good for you. It's for your own autonomy of your own health. And if you love yourself, then you should practice self-care. It's a mother knowing how to manage her child's fever Is a young person accessing an HIV self-test kit without fear? Is a community members who are trained to respond to accidents before any help arrives? That's what we talk about self-care. Our system needs to shift. This shift, we need solutions which work. It needs approaches that do not collapse when funding dries up. We need approaches. That's why we are here tonight in the award, that these awards matter for all of us. They show us what we want is possible when we trust in communities, when we invest in the people, and when we innovate and lead. I've had the privilege of visiting health facilities in nearly every region of this country. I've seen the quiet strength of the midwives in Gulu, the ingenuity of the young-led health startups in Mbarara, and the resilience of the health workers in West Nile during refugee surges. These experiences remind us that our health system is not just built in Kampala, it's built in every district, in every community, and in every home. We must also recognize the role of the private sector, the civil society. Most of the innovations we celebrate tonight, whether in digital health, supply chain logistics, or community outreach, have come from partnerships. That breaks traditional boundaries. If we want to build a truly sustainable health systems, we must keep these partnerships alive and growing. Finally, I want to speak to the young people in the room. You are not just the future, you are the present. Your ideas, your energies, and your refusal to accept the status quo is exactly what our health sector needs. You have the power to avert unwanted pregnancy. So keep pushing, keep questioning, keep building, and we are here to listen, and we are ready to support you. To all the winners and the nominees, thank you. You did not wait for the perfect conditions. You acted, you cared, you made a difference. And tonight, we honor you, not just what you have done, but what you represent. Let us carry the energy forward. Let's build all the health systems that listens, adapts, and empowers, and one that does not just survive, but thrives. As I end, I would like to take the opportunity to announce the first awardee this evening during these 6 Heroes in Health Awards. And the winners are all those ones who are practitioners of self-care. So if you know that you yourself, you practice self-care, this award which I have given now, all of you qualify for it. It's a mental award, so don't expect a physical award. I want once again to congratulate all our heroes, and thank you, congratulations, and thank you for listening to me.
Thank you so much, Dr. Olaro. A round of applause for Dr. Today would not be possible without each and every one of you present in this room, but I'd also like to take this opportunity to appreciate certain members who went even a step further, starting off with the Ministry of Health. This is how you do it. This is how you show appreciation in that level of class. When I look around, I'm like, I could have gotten married today. It's so beautiful. Well done. You're wondering how I'm still single, eh? Nange, even me, I wonder. I would like to appreciate our partners who are also part of this. MHS, World Health Organization, Stanbic Bank, Uganda AIDS Commission, Inspire Africa Group, Living Goods, Equity Bank, PSI Uganda, NBS, National Water Sewerage Corporation, Clinton Health Access Initiative, Safe Places Uganda, Signature Africa, PSU, and the Allied Health Professionals Council Uganda. A round of applause for all our partners. Thank you so, so much. But the biggest round of applause I want to give is to you. You have been here from 8 in the morning, and yet you still have a smile on your face. Thank you. Thank you so much. And in the interest of time, I will move on for us to move on to our next speaker. I would like to invite the head of the HIHA Judges Committee, that's Professor Moses Galukande, who is going to now take us through how did we come to these winners? How did we conclude with even these nominees? What was the process? What happened? The Electoral Commission in it? Was there bribes or not? How? So that also you can know next time, how can I be able to be part of this award ceremony and also be a winner as well. A round of applause for the judging committee of the HIHA. You're not going to dance for me, Professor? Hey, I like it. Welcome. A round of applause for our judging committee.
All protocol observed. Good afternoon, ladies and gentlemen. Thank you for making the time to come to this 6th edition. This is the panel of judges that I've had the privilege to work with as we executed this job. I'll ask each one of them to introduce themselves so that you can hear their voices as well.
Good afternoon, ladies and gentlemen. All protocol observed. My name is Janet Kantalama, a psychologist, and the Executive Director of Safe Places Uganda. I'm honored to be part of the judging panel and to have all of you here looking lovely. Enjoy your evening. Thank you.
Good afternoon, ladies and gentlemen. My name is Stella Josephine, sister. I'm a little sister of St. Francis. I'm a nurse tutor, and I'm very happy to be one of the judges whose products we are going to celebrate today. Have a good day and enjoy. Thank you.
Good afternoon, everyone. I'm Dr. Fualal Jane Odubu. I'm a retired senior consultant breast and endocrine surgeon, and I'm the current national or Uganda chair of the Uganda Medical Board. I'm happy to see you all. Enjoy, and congratulations to the nominees and the awardees.
Assalamu alaikum. I am Professor Majid Kajimu, Professor of Internal Medicine. I'm also a gastroenterologist working at Said Nabak Islamic Hospital. Again, I also congratulate our winners, and I wish them success in their lives and in role modeling for our communities so that our young people can follow their example.
And good afternoon. Joseph Okware, Director and the Minister of Health. I am part of this invisible and incorruptible committee of judges. Welcome.
Thank you very much, judges. We definitely have back staff. We have IT and IT team and the secretariat that do help to make our work a little easier. We often have many nominations, and this time around wasn't an exception. We needed about not less than 30 hours together in one room to do this. One of them was a Sunday, so I really appreciate these people for their for their sacrifice. Thank you very much. I'll just say a few words and then hand over to the next person. This is the 6th edition, and it's amazing how time runs. Maybe time runs when you're doing good things. So we've seen 5 editions before we go to this. It is evolving. This morning we had the African Health Summit as part of this. So it's spreading its wings, growing in stature, and we are excited not only for today, but what the future holds. So how do we get the nominees and the awardees? This is largely a public, the public nominates, and we often get over 10,000 nominations. They nominate, there's a platform we use through which they nominate. Sometimes they send emails, and then we go through what the nominations are like and make sometimes a difficult decision, sometimes an easy decision on who the winner is or are in the different categories. We've used a criteria of 5, so we have a 5-point scale we use. We look, not in any order of importance, we look at the referees, who is nominating, and we are normally averse to self-nomination. So if you nominate yourself, we are normally not very interested. So who the nominees, the referees are, we assess impact of the work that is being nominated. We check collaboration. Often good things in life are done in collaboration. So that's criteria number 3. 4 is the level of difficulty that was overcome to get where that individual or that entity got to. And of course the track record, which is also important. So that's the 5-point criteria that we use. We deal with conflict of interest. If any one of us is conflicted, we declare and exclude ourselves for that particular individual entity that we are scoring. We really appreciate this whole exercise, and we thank the Minister of Health for giving us this honor and privilege to do this. We are amazed at how this inspires. Recognizing people inspires, it motivates, and it meets a need to be appreciated. I think it's a human need to be appreciated when you do something good, to be appreciated, and I guess it's more than money. So we are happy to be part of this each time. So in conclusion, we thank the public for being enthusiastic about these awards, and we pray that that interest is sustained years to come. We thank the nominees and congratulate them for amazing work that's done. We had the privilege of reading through the stories and making the phone calls and clarifying many things. We thank the backroom staff for the work they've done, the service providers, including the media. And thank you very much, everyone, for sparing the time and coming to celebrate with us this amazing event of Heroes in Health. We wish you a pleasant afternoon. Thank you.
Thank you so much to our judging committee. A round of applause for them for the hard work, diligence, and transparency that was executed. Thank you. All right, let's get straight into it, okay? Let's put the nerves aside. Let's start off with the very first award. We're getting to the award ceremony. Are we ready? I'm going to take this opportunity to let you know that we are starting off with the Midwife of the Year Award. And I would like to invite the Permanent Secretary, Dr. Diana Twine, to join me as you give us the honor of giving out the award. Please remember that the gift hampers today are given to us from Inspire Africa Coffee. They are Uganda's coffee company in championing value addition when it comes to coffee. Dr. Diana Twine, you look absolutely beautiful. Ladies and gentlemen, and the nominees are
Agnes Chirikumino has served as a midwife for 23 years, demonstrating exceptional dedication to saving the lives of mothers and their babies. She provides compassionate support to women in labor, identifies complications early, ensures safe deliveries from once breastfeeding, and mentors young midwives entering the profession. Her expertise
I'm waiting for them.
Figure in her facility and a trusted figure in her community. Sarah Katutu, working at Healing Way Hospital in Bukololi, Kampala, has been described by some mothers as an angel. She is unhesitating in her compassion, willing to clean a mother's blood, regardless of the severity of the situation, with a smile on her face. She diligently follows up on her patients, ensuring that all necessary procedures, such as immunization and care for both mother and child, are thoroughly attended to. Other mothers have praised her humility, work ethic, and unwavering commitment. Rebecca Ariamo is a dedicated and compassionate registered midwife serving at Okinga Health Center 3 in Bandari District. With over 20 years of service, she has become a pillar of maternal and newborn care in her community. Her career began at Dr. Abrasoli Memorial Hospital in Kalongo, and for the past 18 years, she has served under the Padere District local government. She has supported countless mothers through safe deliveries and guided fellow health workers with compassion and skill. In 2021, while on night duty, Ariamo faced a personal tragedy when her 18-month-old son drowned as she attended to a mother with a complicated delivery. Despite this profound loss, she continued to serve her community with courage and grace, embodying the resilience and selflessness of frontline health workers.
All right, ladies and gentlemen, the winner of Midwife of the Year takes home a plaque from the Ministry of Health. Will also be receiving a gift hamper from Inspire Africa Coffee, as well as a check from Stanbic Bank worth 2.5 million Ugandan shillings.
Ladies and gentlemen, the midwife of the year is Ariamo Rebecca.
Chosen generation, we've been called for to show His excellence. All I require for life, God has given me, and I know who I am. We are a chosen generation, we've been called for to show His excellence. All I require for life, God has given me. For I know who I am. I know who God says I am. What He says I am. Where He says I'm at. I know who I am. I know who God says I am. What He says I am. Where He says I'm at. I know who I am. I'm working in power. I work in miracles. I live a life of favor. For I know who I am. I'm working in power. I'm working miracles. I live a life of favor.
Rebecca,
For I know who I am.
I'll just give you.
Thank you, the Minister of Health, everyone. I'm too glad to be here. I'm by the name Ariamo Rebecca. I work in Padere. Okinga Health Center 3. As is written in the books, I love my work. I've worked for 22 years now. I worked for 4 years in Kano, Dr. Mbuzoli Memorial Hospital, then 18 years in Pade. One time when I was handling a mother in labor, I was the midwife, I was the attendant. Unfortunately, the mother ended up with complication. That is, a midwife knows what is shoulder dystocia. So the baby ended up with severe asphyxia and the mother with PPA. But I managed them. I thank God for my patients. They love me, I love them. And when I'm here, I'm passionate about them all the time. They called me, sister, where are you? We need your service. I'm not afraid to give my number to all of them who want my services. Thank you so much.
A round of applause to our midwife of the year. Thank you so much, Dr. Atwine. Right. Now it's real. There we go. Congratulations. Moving on to our next category. And for our next category, which is Nurse of the Year, I would like to invite the Chair, Health Service Commission, Dr. Henry Mwevesa, to give us the honor of giving out this award. Dr. Henry Mwevesa, who is the Chair, Health Service Commission. All right, ladies and gentlemen, and the nominees are
Rosemary Abalo. Rosemary Abalo is a dedicated and compassionate assisting nursing officer with 11 years of service. A graduate of St. Mary's Hospital Lakar School of Nursing, Abalo embodies professionalism, ethics, and patient-centered care in every aspect of her work. Abalo is known for her dedication to her patients, providing quality care without discrimination, responding to emergencies beyond duty hours, and ensuring every patient receives timely, respectful, and dignified treatment. She values night shifts, believing that patients deserve equal care at all times. Doreen Katshawe. Doreen Katshawe is a deeply compassionate and resilient nurse whose career spans nearly 2 decades. From her early days at Mulago during nursing training to her current role in the neonatal intensive care unit at Mbara Regional Referral Hospital, Katshawe has consistently demonstrated exceptional care and dedication. Whether caring for chronic heart patients or fragile newborns, Katshawe brings warmth, patience, kindness, and professionalism to every shift. Charlotte Angwena. Charlotte Angwena, a registered comprehensive nurse with a Bachelor of Science in Nursing, is one of the most experienced and skilled ICU nurses in Uganda. She currently serves at International Hospital Kampala and supports intern training at Naguru Hospital. She is known for her confidence, leadership, and deep knowledge in critical care. Her compassionate approach, excellent communication with patients, families, and fortitude make her stand out. Her presence brings comfort and reassurance, making her an invaluable asset to the nursing profession.
Ladies and gentlemen, I would like to remind you that the winner of Nurse of the Year walks away with a plaque for the Ministry of Health. a gift hamper from Inspire Africa Coffee, and as well as a cash prize from Stanbic Bank worth 2.5 million Ugandan shillings.
Ladies and gentlemen, the nurse of the year is Rosemary Abalo.
Celebration no fire. Oh, one in a mujalo, one in no one. Life is so sweet, oh, son. So did they make a people thank God?
Congratulations to our winner, Rosemary Abalo.
So did they make a people thank God?
Of the year.
Nobody people thank God. I was just a bando. Ah, thank God. When you come to the night party, thank God. Ah, thank God.
Oh, gentlemen. Congratulations to our nurse of the year.
Make a vision that will make it happen. Make a vision that will make it happen again. So when you move your body, baby, get ready. Get ready. So when you move your body, baby, get ready. Get ready. Now DJ play the song with thank God. And I'm with you, and move. Now everybody sing goes on. Come out with the singer bando. So DJ make the people thank God.
All right.
Thank you very much, Protocol Observed. My name is Abalo Rosemary. I'm an Acholi. Thank you so much for this award, Ministry of Health. Thank you, my Executive Director, everybody. And thank you, I kneel down for my patients who have been telling me that Musawo Katonda akuwecho singo okwagala. Thank you so much. May the good Lord reward everybody. And as a nurse, we really gain when our patients recover. But when they die, we feel bad. I feel so bad. And I thank Lacho School of Nursing for training me. My principal tutor is Zaga Juliet, and also the top nurses from Lacho School of Nursing. Then also PNO, everybody. I'm so happy. God bless you. God bless everybody. Thank you. Afoyo Mate.
Afoyo. Oh, thank you so much. Congratulations to Rosemary. Thank you so much, Doctor. All right, the celebration is happening. All right, speeding this along. Yes, congratulations to our Nurse of the Year. A lot of work in the nurses. Midwives and nurses have a special place in my heart. My grandmother was one of the first midwives in Uganda, so congratulations to them both. They do so much work. Now, I will really be amiss if I keep giving out money, but the one who is giving out does not say something. You might think it's me giving it to you, correct? So I would like to invite the representative for the CEO of Stanbic Bank to just give us a few remarks before we go into our next big category, because we really, really do appreciate all that you've done for us. A round of applause to Stanbic Bank.
Good evening, distinguished guests, partners, and our incredible health professionals. My name is Diana Ondoga. I serve at Stanbic, and I'm here to represent the Chief Executive, Mumba Kalifungwa. He sends you his regards. Congratulations to Rosemary and Rebecca for Midwife and Nurse of the Year. Tonight, we celebrate true heroes, the doctors, nurses, innovators, and caregivers whose dedication keeps Uganda strong and hopeful. On behalf of Stanbic Bank, I want to say thank you for your service, sacrifice, and innovation. We are especially proud to be associated with the HIHA Awards since their inception, and we pledge our continued support. This initiative aligns deeply with our purpose and positive impact framework, which drives sustainability and shared prosperity for Uganda. Across our continent, we must claw back the resources that are leaving Africa and channel them into local healthcare infrastructure, human capacity, and innovation. Because building resilient health systems is not government's job alone. It requires partnership across the private sector, public sector, and the community. At Stanbic, we believe that sovereignty in health is built through solidarity, innovation, and shared investment. Our purpose is simple. Uganda is our home, Africa is our home, and we drive her growth. We bring this to life through our positive impact growth agenda for women, youth, and farmers, anchored on 5 pillars: financial inclusion, enterprise development and job creation, infrastructure investment, climate resilience, corporate social investment focused on maternal health, youth entrepreneurship, education, and environmental conservation. Through our partnership with Ministry of Health, we invest more than 800 million annually to equip health centers across Uganda, ensuring that no woman dies while giving birth. Through Stanbic Medicare, we are expanding affordable health insurance so that illness never means financial ruin. And we support our healthcare heroes with access to finance and professional growth, because when health workers thrive, the nation also thrives. Our work contributes to Uganda's progress towards the Sustainable Development Goals, especially good health, gender equality, decent work, innovation, and partnerships. The future of investment in Africa's health lies not in aid, but in building local partnerships and innovation. Let us continue to invest in the health of our people, because in doing so, we invest in the future of our nation. Health is wealth, and wealth must begin at home. It's now my honor to present the most prestigious recognition of this evening, the Doctor of the Year Award, celebrating excellence, compassion, and service that uplifts us all. Thank you and congratulations to our heroes.
A round of applause. So I'm going to kindly ask Diana to stay with me here on the stage as we move on. All right. At this juncture, ladies and gentlemen, allow me invite our Honorable Minister of Health, Dr. Ruth Acheng, to invite, in her capacity, all protocol observed, our guest of honor. A round of applause.
Our chief guest, allow me to welcome you back. Thank you very much for being with us here in the morning and again this afternoon as we award our health workers. I am sure you have seen an example of what goes on in the Heroes in Health Awards and how excited our health workers are. We are ready to listen to you, and I humbly request that you come and give us your statement, but thereafter, I'll request you to award the lifetime awardees. Right Honorable, you're most welcome.
Thank you so much, Honorable Minister. Tonight, as we gather to close this year's Africa Health Summit, I stand before you not with the posture of a speaker addressing a formal sitting, but as a brother among brothers and sisters, humbled, inspired, and deeply grateful for what we have lived through together over the past few days. Indeed, Kampala has hosted us with grace, warmth, and generosity. I would like to begin by sincerely thanking the government and the people of Uganda for welcoming us not as delegates, but as family. This summit has been many things: a forum for ideas, a marketplace for innovations, a meeting of policymakers, and a training ground for the next generation of African health leaders. But above all, it has been a community. Whether it was in the plenary halls, over a cup of tea, during the side sessions, or in the quiet moments between panels, something powerful happened here. We connected, we learned, we grew together. I have seen friendship formed, partnerships born, and futures rewritten, all within a span of days. And this, to me, is the true hallmark of a successful African convening. We honored Africans' extraordinary health heroes, the women and men whose courage lies dark hospital corridors, whose compassion travel across villages and mountains, whose innovations pushes the boundaries of what is possible. Their stories moved us. Some of them shocked and shook us. Others reminded us that even in the most difficult places, Africa produces giants, steadily, selfish, selfless, and unstoppable. These heroes are not an exception. They are a reflection of who we are as a continent: resilient, creative, and forever refusing to give up on each other. This year's theme, which is self-care, could not have been more timely. Not the commercial version of self-care we often see on social media, but the African version: community-rooted, dignity-restoring, and empowerment-driven. Self-care is a mother in Tororo learning to check her baby's danger signs. Self-care is a young woman in Mombasa confidently using self-testing kits. Self-care is a border rider in Gulu managing his blood pressure with the simple tools he understands. Self-care is a community taking ownership of its well-being. We leave this summit with one clear understanding: self-care is not a trend, it is a revolution. As we return to our different nations, we must carry three things with us. First, a renewed sense of responsibility. Our people are looking to us, policymakers, health leaders, partners to make their lives better, healthier, and more dignified. Second, a renewed sense of possibility. This summit has shown us that African solution exists, African expertise exists, and African excellence exists. Third, a renewed sense of unity. We are stronger when Uganda's success is Kenya's success, when Senegal's victory is Ghana's victory, and when South Africa's breakthrough belongs to all of us. Allow me to say something rather personal. In my years of public service, I have attended many conferences and many summits, but very few have carried the spirit I have felt here in Kampala. A spirit of sincerity, a spirit of shared purpose, and a spirit of community. This summit has reminded me of something profound. African health is not just a sector. It is our identity, it is our dignity, it is our collective future. To the organizers, volunteers, moderators, and technical teams, and everyone who worked behind the scenes, we say thank you so much. Your hard work gave us an unforgettable summit, your passion gave it the soul, and your dedication gave it the impact. So tonight, as we draw the curtains of this summit, let us carry its fire with us. Let us go home with renewed determination, not to admire the conversation we've had, but to implement the commitments we have made. Let us not wait for another crisis to remind us of our responsibility. Let us be proactive, decisive, and bold. May God bless each one of you for the work you have done and you're to do to heal our continent. May He bless the Republic of Uganda for hosting this summit with such warmth, and may He bless our beloved continent of Africa, a continent rising, a continent healing, and a continent ready for its future. Thank you all, and may God bless all of us. Thank you so much.
All right, at this juncture, I would like us to move on straight. Ladies and gentlemen, for the Lifetime Achievement Awards. Lifetime Achievement Awards.
Dr. Ian Clark. Dr. Ian Clark is a visionary physician, entrepreneur, philanthropist, and former politician. Clark arrived in Uganda in 1987 during the national recovery from civil war and the HIV/AIDS epidemic. Driven by a passion for innovation and sustainability, Clark founded International Hospital Kampala, the first private hospital in Uganda to perform open heart surgery. He also established the International Medical Group, Uganda's largest private healthcare network. He founded Clark International University, which trains health professionals and leaders, and Clark Junior School, which is promoting holistic education. His commitment to public service led him to serve as mayor of Makindye Division, where he improved infrastructure and public health systems. Dr. Eva Kajumba Muganga. For more than 50 years, Dr. Eva Kajumba Muganga has stood as a pillar of excellence and compassion, a renowned pediatrician and the founder of St. Catherine's Hospital on Buganda Road in Kampala, with branches in Nigeria and Chira in Wakiso. Kajumba has dedicated her life to nurturing and protecting the health and well-being of children. Colleagues describe her as a meticulous and deeply compassionate physician who treats every child as her own and leaves no detail unattended. Through her mentorship, she has shaped generations of Ugandan doctors, instilling discipline, empathy, and professionalism. As a private sector leader, Kajumba has created meaningful employment for over 100 staff members at St. Catherine's Hospital. Engineer Sam Wanda. Engineer Sam Mwanda has quietly and steadily built the backbone of Uganda's health system. A civil engineer by training and a nation builder by calling, Mwanda's 44-year journey in public service stands as one of noteworthy integrity, brilliance, and purpose. From his humble beginning as a pupil engineer in 1978, Mwanda rose through the ranks of public service with rare devotion, serving in the ministries of housing and urban development, lands, and later health, where his fingerprints can be found on nearly every major health infrastructure project of the last 3 decades. His leadership shaped the rehabilitation and expansion of Kayunga and Yumbe hospitals, the construction of the Ministry of Health headquarters, and the upgrading of national hospitals and health centers across Uganda. Dr. Kenneth Chapman Chigozi. Dr. Kenneth Chapman Chigozi is an American-Ugandan dentist, missionary, and mentor who dedicated over 45 years to advancing oral health care in Uganda. He arrived in the country in 1979 as a full-time staff member of Campus Crusade for Christ. He later established a dental clinic at Mengo Hospital in Kampala during Uganda's post-conflict recovery period. Embracing Ugandan culture, he adopted the Luganda name Chigozi from the Fumbe clan and became fluent in Luganda, earning admiration as the father of dentistry in Uganda. Chapman focused on training Ugandan dentists and health professionals, significantly improving the country's dental standards. His holistic approach combined faith, cultural integration, and professional excellence, leaving a lasting legacy. Mr. Wolfgang Jindoffer, Light for the World. Ladies and gentlemen, tonight we celebrate Mr. Wolfgang Jindoffer, a true hero in eye health whose life's work has restored sight and hope to millions across Africa. Since arriving in Uganda in 1985, Wolfgang has devoted nearly 40 years to transforming eye care. A German national who made Uganda his second home, he has touched countless lives with compassion, commitment, and quiet leadership. As thematic director for Child Eye Health at Light for the World, he led programs in Uganda, Ethiopia, Mozambique, and Burkina Faso, reaching almost 1 million children. He trained specialists, equipped hospitals, and built partnerships that made affordable, quality eye care a reality for all. Through diplomacy and tireless advocacy, he mobilized major donor support and strengthened collaboration with global partners such as the World Health Organization. As he steps into retirement, we honor a visionary whose light continues to brighten the future of children and communities across Africa.
For the Lifetime Achievement Award, and then representing Dr. Kenneth Chapman. Yes, thank you so much, representing Dr. Kenneth Chapman Chigozi. Right. Dr. Eva Kajumba is around, but she's unfortunately not able to come all the way. So we do have our
Jerusalem, ikayalami.
Ladies and gentlemen, the Right Honorable is very accommodating and will go to our Lifetime Achievement awardees to hand over their awards. Congratulations. All right, we also have Wolfgang. Take a good picture right now.
representing Dr. Ian Clark, Dr. Kenneth Chapman, and also being present, Mr. Wolfgang Gindorfer. The Right Honorable has said he will come to our Lifetime Achievement Award winners who are not able to make it up these many steps because they have a few complications. A round of applause to him for that. That is what they call leadership. Thank you so much, Right Honorable Dr. Jane Ruth. That's Dr. Eva Kajumba Muganga, Engineer Sam Wanda. If we could have all the Lifetime Achievement Award winners join on the stage to take a group picture as a group. The Lifetime Achievement Award winners, if you could all go on the stage so it can be a group picture. Thank you. All the Lifetime Achievement Award winners, if they would just join on the stage for the final group picture. Big congratulations, a round of applause. Dr. Kenneth Chapman Chigozie, Wolfgang Gindorfer.
Let's celebrate. There's a party going on right here, a celebration to last throughout the years. So bring your good times and your laughter too.
Congratulations.
We gon' celebrate your party with you. Come on now.
Thank you to the Right Honorable for being with us. He had to excuse. He's running an entire country from another country, so we had to excuse him. Shall we proceed? All right. And now we're moving on to this category. Now, a little birdie has come to me and said, more than, yeah? And I would like to appreciate Signature Africa. First clap for them before I tell you what they have done. A round of applause for Signature Africa. You never knew you could be the one getting. So Signature Africa have said, you know what? That was not enough for the midwife of the year, for the nurse of the year. And now we're going to go into the doctor of the year. They said, let us more them. Give them a little bit more. And they've said they've given them an all-inclusive breakfast, lunch, dinner, all-inclusive 3-day Lake Mburo National Park Safari experience. A round of applause to Signature Africa. The CEO is present. If you could stand up and just wave so we could acknowledge you. And you're the CEO. Wow. Are you happily married? Just joking. All right. I would like to invite Diana, the representative from Stanbic, again to join me as we move to our next category. I'd like to, which is Doctor of the Year. I'd also like to take this opportunity to invite Honorable Dr. Mohammed Hassan Mohammed Bulale, who is the Deputy Minister of Health and Human Services for the Federal Republic of Somalia, to give us the honor to give out the next award. Moving to the next award, which is Doctor of the Year.
Dr. Charles Ibingira. Dr. Charles Ibingira exemplifies professionalism, compassion, and dedication. Renowned for his commitment to patient care, he has earned widespread recognition for his healing touch and tireless service. He has mentored and shaped the careers of countless young doctors, instilling values of integrity, empathy, and excellence. His leadership has contributed to the growth of some of the region's most respected health facilities. With numerous testimonials, he stands out as a beacon of hope and healing, making a profound impact on lives and setting a gold standard for medical practice. Dr. Onesma Sahabwe. Dr. Onesma Sahabwe, an obstetrician and gynecologist serving as an associate consultant at Kabale Regional Referral Hospital, has built his reputation in the quiet theaters of rural hospitals. Since beginning his medical journey at Chisizi Hospital in 2012, Ahabwe has worked with humility and persistence, serving communities across Bugangari, Kebisoni, Rubaya, and Mparo. He has coordinated programs bringing structure and guidance to health systems that rely on dedication more than resources. Dr. Malik Sempereza. For over 10 years, Dr. Malik Sempereza, a leading Ugandan dermatologist and the founder of Unity Skin Clinic, Roswell Specialist Hospital, and Kleben Skincare, has transformed the landscape of skincare, women's and children's health, heart health, and more in Uganda. He was a pioneer in introducing phototherapy for vitiligo, restoring hope to patients who had endured years of stigma and silence. When COVID-19 hit, he reached out to patients countrywide. Sempereza stands as a model of what modern compassionate medicine should be: accessible, ethical, and deeply human.
All right, ladies and gentlemen, I'd like to let you know that the Doctor of the Year walks away with a gift hamper from Inspire Africa Coffee, and they have also gotten a gift from Signature Africa, a placard from the Ministry of Health, and a whooping 5.5 million Ugandan shillings from Stanbic Bank.
Malaika, may we please sing the national anthem again? Doctor of the Year award is
Dr. Onesma Magezi Ahabwe.
Dr. Onesma Magezi Ahabwe. Ladies and gentlemen, the Doctor of the Year. A round of applause for Dr. Onesma Magezi Ahabwe. This is the Doctor of the Year. What a prestigious award to receive. 5.5 million Ugandan shillings coming from Stanbic Bank. A 3-day all-inclusive pay to Lekamburu National Park Safari Experience from Signature Africa. A gift hamper from Inspire Africa Coffee. Alright, Doctor, I need you for a few seconds. Dr. Onesma. Doctor got the money and said we have God.
I'm Dr. Onesmus Ahabwe. I work with Cavalry Regional Referral Hospital. Newly posted there as an obstetrician for the last 1 year, and that is after a long journey through the health center force. And I am very passionate. I believe this was worth it. But my motivation comes from when I imagined 40 years ago, my mother giving birth to me from a very humble background. And so every time they say there's a mother to save, I picture that of my late mom, and that gives me the motivation to keep going despite the hardest of the hardest circumstances. So thank you very much, Minister of Health. I now believe that wherever you are, your effort is being recognized, and I do not take it for granted. I am more thrilled to even do better, God being by my side. I thank you.
A round of applause to our doctor, Honorable. Thank you so much, Diana. So before Honorable and Diana, you go, please first stay. No, before you go. Wama, did you see me laughing there? Uncle Lugambo. I tell you what we were laughing about. So say what you said.
I think the venue was ready, and we were ready. So someone is going to Mogadishu, Somalia, to give present in other place, yeah? Thank you very much.
Saga, ngenda bye. But you said he needs to have what?
Thousands of cows.
Thank you. I need you all witnesses. It is done. It is finished. All right. Now let's go to our next category. I want to just have you a breather. That was a very exciting moment to our Doctor of the Year. A few things changed up a bit, but now I'm going to reset it a little bit and then move on to the Community Health Extension Worker of the Year. And for that, I would like to ask if Amy Kakiza could please kindly join me. That's the Director of Advocacy and Strategic Partnerships, Amy Kakiza Riki Hembo, to give us the honor. There we go. Thank you. Ladies and gentlemen, and the nominees are...
Good job.
Jennifer Faith Nabwana. Through awareness campaigns, Jennifer Faith Nabwana has addressed communicable and non-communicable diseases, fostering informed and healthier communities. Her commitment extends to community outreach, where she regularly visits homes to monitor health conditions and identify high-risk groups. She has reported, identified, and documented disease outbreaks and maintained vital records on births, deaths, and other health indicators. Her tireless efforts have led to meaningful change, empowering her community to take charge of their health. Ronald Mary. Ronald Mary is a highly active community health extension worker serving in Lira City, northern Uganda. He is known for his compassionate and proactive approach to service delivery, particularly in immunization, nutrition for pregnant mothers and children under 5, family planning, and supporting VHTs. At an immunization center in Lango Central Ward, Mary provided critical support to mothers whose children had missed vaccination, demonstrating his dedication to closing immunization gaps. His effort in client education, guidance, and sensitization has significantly improved health outcomes in the community. Patrick Olunga has demonstrated exceptional commitment to improving maternal and child health within the community. Through timely home visits, he identifies danger signs during pregnancy and ensures prompt referral to the health center, contributing to safe delivery. He consistently educates women on recognizing warning signs and encourages facility-based childbirth. After delivery, he provides vital guidance on exclusive breastfeeding, malaria prevention, routine immunization, and access to family planning services.
All right, ladies and gentlemen, for this award, which is the Community Health Extension Worker of the Year, the person will walk away with a plaque from the Ministry of Health, as well as a gift hamper from Inspire Africa Coffee, and a cash prize from Stanbic Bank worth 500,000 Ugandan shillings.
Ladies and gentlemen, the award for Community Health Extension Worker of the Year goes to Jennifer Faith Nabwana.
Everything me give her in the show me touch it on, yeah. Oh no man, I cooler. It's what I change, makula, yo.
Ladies and gentlemen, our winner, Jennifer Faith Nabwana, who is the winner for Community Health Extension Worker of the Year.
Like the fire, no. Give me fire, woman, I need your body, don't. No, the dribble like the Ronaldo. Wanna crush my baby like you come a tornado. We are from home. We are the man. Bobo take you to you now. We are from home. Oh, that's a problem. We are from home. Bobo take you to you now. Yeah, Chiqualero. No, Chiqualero. Boy, Chiqualero. Boy, Chiqualero. Yeah, Chiqualero. No, Chiqualero. Boy, Chiqualero. Boy, Chiqualero. Because we look it up, we touch it up. Sticks to a Roger Chameleon, we book it up. And it's a girl, we know rook it up. Wine and dirty, yeah. Calabuda, me say, Gala fire, no. Everything we give her in the show, me touch it on. My Gala post a party over your man, they must say. Too bad, to go back and kapana.
Thank you so much. I take a seat. A round of applause to our winner, Jennifer Faith Nabwana, who is the Community Health Extension Worker of the Year. DJ,
Your love is making me go crazy.
All right, great. And I also want to thank you so much. All right, moving on to our next category. I would like to invite, for our next category, we have use of ICT and innovation to improve patient care. I would like to invite Honorable Dr. Musenero Monica Masanza, who is the Minister for Science, Technology, and Innovation.
Emmanuel Kamuhire. Emmanuel Kamuhire's creation, the A-Light Vein Locator, uses red light technology to accurately and non-invasively detect veins, a breakthrough for clinicians treating sick children with collapsed or hard-to-find veins. Piloted in 2022 across 4 hospitals with approval from the Ministry of Health and Ugandan National Council for Science and Technology, A-Light has already improved care for more than 10,000 patients, reducing failed IV attempts, minimizing pain, and enhancing safety for patients and providers. MEDIC has been a trusted partner of the Ministry of Health in advancing digital transformation at the community level. Through its electronic community health information system, MEDIC has empowered more than 19,500 VHTs across 33 districts to deliver real-time doorstep care. The mobile platform enables VHTs to conduct integrated community case management, assessing and treating malaria, pneumonia, and diarrhea, monitoring household hygiene, and tracking maternal and child health outcomes. Streamline Health Tech Limited.
Streamline Health Tech Limited is redefining healthcare delivery in Uganda through technology that blends innovation with compassion. At a time when hospitals relied on fragile paper systems and families struggled to afford care, Streamline built practical, homegrown solutions that transformed how patients are served and protected. With more than 2 million patient visits digitized, over 100 hospitals transformed, and 75,000 families protected, Streamline Health Tech stands as a model of how African ingenuity can save lives and restore dignity to healthcare.
I wish to congratulate all those who have been nominated. It's not easy to make it to this level. The winner of the use of ICT and innovation to improve patient care award goes to Streamline Health Tech Limited.
Congratulations to our winner, Streamline Tech Limited is taking on
Streamline Health Tech Limited.
Ladies and gentlemen, the winner of the use of ICT innovation takes home a plaque from the Ministry of Health and a gift hamper from Inspire Africa Coffee.
Sentolina, you got money to it, I got Kalina. Sentolina, Coca-Cola, I go be a darling.
A big congratulations, a round of applause to Streamline Health Technology. Thank you, Honorable. Truly appreciate your time. All right. We're moving on to the next category, which is the Village Health Teams Award. And I would like to invite Dr. Robin Nandi from UNICEF to give us the opportunity to give over this award. Dr. Robin Nandi from UNICEF.
Tony Bisoboka. Tony Bisoboka is a committed VHT member whose work in Nansana has transformed community health awareness. He educates mothers on immunization, antenatal care, hygiene, and child nutrition, promoting practices like exclusive breastfeeding and proper hand washing. His sessions at Tikalu Health Center 3 have left lasting impressions, with many community members praising his ability to simplify complex health topics and inspire action. Bisoboka has made a remarkable impact in eye health, identifying over 25 patients with optical issues and personally facilitating their access to surgery at Mengo Hospital. Alfred Mutika serves at Mutara Health Center 3 in Mitoma District. With over 20 years of service, he has become a passionate advocate for community health. He is passionate about sharing his deep knowledge of malaria, HIV, and self-care practices to different communities. He is a strong advocate for male involvement in family planning and is always available to offer guidance. His dedication and ability to connect with people in everyday settings make him an invaluable resource and a true champion of grassroots health promotion. Angelina Tukwasiwe. Angelina Tukwasiwe, affectionately known as Karunji, has served as a village health team member for nearly 20 years. Her dedication to her community is unmatched. She voluntarily guides women on family planning, distributes short-term contraceptive methods, and supports midwives during peak service days. Tukwasiwe is deeply involved in mobilizing women for health services, assists with data capture crucial for stock management, and provides empathetic guidance to women learning self-injection. Her follow-up ensures continuity and confidence among clients, helping them take control of their reproductive health.
All right, I was kindly asking if I could kindly have the of Signature Africa, Mr. Duncan Kiza, to please join me and give me the honor of giving out this award. The CEO of Signature Africa. There we go. Thank you, sir. And I would like to let you know that the winner of this award wins themselves a plaque from from the Ministry of Health. Also gets themselves Inspire Africa gift hamper and a cash prize from Stanbic Bank worth 500,000 shillings. Ladies and gentlemen, the winner.
Tony.
The winner for the Village Health Team Member of the Year is Mr. Bisoboka Tony. A round of applause and congratulations to
Bisoboka. You are nice. Hunter de Mukasunda Bas. Holy Wape, Holy Walais. Holy Telekuchi over Passage. Holy Origin. Tony Robert.
Congratulations to you. Winning himself a cash prize of 500,000 shillings from Stanbic Bank, a gift hamper from Inspire Africa Coffee, and a plaque of congratulations from the Ministry of Health. That's the HEHA Awards Heroes in Health Awards 2025. This is the Village Health Worker of the Year. That song, eh? When in health, you're saying Temen Singo, like. For our next award, we're moving on to the Award of Excellence in Palliative Care. Allow me please welcome from you a representative from UAC. A representative from UAC. And the nominees are
Dr. Jacinta Amandua. For more than 40 years, Dr. Jacinta Amandua has spearheaded compassionate, accessible palliative care. As former Commissioner for Clinical Services at the Ministry of Health, he championed the integration of palliative care into Uganda's national health system, transforming it from a niche service into a core component of healthcare delivery. Amandua was instrumental in the early introduction of oral liquid morphine in Uganda, a breakthrough that made pain relief affordable and accessible to patients with terminal illnesses. A founder of New Life Hospice Arua, Amandua brought dignity and hope to patients in the West Nile region. Professor Julia Downing. An honorary professor at Makerere University and one of the first 2 professors of palliative care in sub-Saharan Africa, Juliet Downing has spent more than 2 decades advancing education, research, and compassionate practice. A founding member of the Palliative Care Association of Uganda, Downing has chaired the scientific committee of the Uganda Palliative Care Conferences for over 20 years, creating a platform where research and humanity meet. Her academic leadership has yielded more than 50 international publications, influencing global understanding of end-of-life care in low-resource settings. Dr. Henry Dungu. Dr. Henry Dungu, a senior consultant in hematology oncology at the Uganda Cancer Institute, embodies scientific excellence and human compassion. A clinician, researcher, and advocate, Dungu has dedicated his career to improving care of patients with cancer and blood disorders, ensuring that relief and dignity remain central to treatment. His mentorship at Makerere University, Bayer University, and McMaster University has shaped oncologists and palliative care physicians. From bedside care to international policy tables, Dungu has consistently advanced one principle: that every patient, no matter their condition or circumstance, deserves comfort, dignity, and hope.
All right, I'd kindly like to take this opportunity to invite the Director General of Health Services, Ministry of Health in Uganda, that is Dr. Charles Olaro, to give us the honor of giving out this award. Thank you so much, Dr. Charles Olaro. A round of applause for him. We are about to find out who is taking home the award for excellence in palliative care. The winner of this award will walk away with a plaque as appreciation from the Ministry of Health, and as well as will walk away with a cash prize from Stanbic Bank worth 500,000 Ugandan shillings, as well as a gift hamper from Inspire Africa Coffee. Ladies and gentlemen, the winner.
And the winner is Dr. Jacinto Amandua.
Dr. Jacinta Amandua. And our winner for palliative care in excellence is Dr. Jacinto Amandua, taking home all these gifts. Congratulations. There we go. That's how you celebrate.
If we took a holiday, took some time to celebrate, just one day out of life, it would be so nice. Everybody spread the word.
I said the best man has gone. Best man, come back. Come back. Congratulations,
All across the world,
Dr. Jacinto Amandua.
in every nation. It's time for the good times. Forget about the bad times. Oh yeah, one day to come together to release the pressure. We need a holiday. If we took a holiday.
Congratulations, Award of Excellence in Palliative Care.
Come on, let's celebrate. Just one day
Thank you so much, Dr. Charles. All right. As your moving talking program, I'm going to let you know what's going on. We're giving out awards, correct? Correct. But we also need to first enjoy the ones we've given. So right after this award, we'll have a small cup break so you can talk to each other, be like, hey, man, even me next year, it will be my turn. I see myself walking up there, right? So I would like for us to move to our next category, which is the Allied Health Worker of the Year. And I would like to invite Dr. Richard Kabanda, the Commissioner Health Promotion, to give us the honor of giving out this award.
Lois Chahiri. Lois Chahiri is a dedicated public health champion whose service has strengthened community health systems. From her humble beginning as a health assistant in Sanga Town Council, Chihura District, Chahiri has grown into a national leader, trainer and mentor whose influence has shaped the quality of primary health care delivery. As a national trainer with World Vision Uganda, she has mentored VHTs in timed and targeted counseling and integrated community case management. Her partnership with the Ministry of Health as the national trainer for the HS app continues to revolutionize community health data reporting and digital health innovation. A physiotherapist, Brian Muhimbura's diligence, discipline, and passion for service have set new standards of excellence in physical rehabilitation and preventive health. For 6 years, he has inspired students, colleagues, and communities from Gulu, Tumbara, and Kampala through his tireless advocacy for movement as medicine. His belief that the doctor of the future will give no medicine but will interest patients in the care of the human frame, diet, and the prevention of disease defines his philosophy of holistic healing. Muhimbura's influence extends beyond Uganda's borders through his leadership role as co-facilitator of the Physiotherapy Future Africa Network, where he continues to shape the future of physiotherapy across the continent. Ambrose Wekwanya. Ambrose Wekwanya's compassion and dedication have brought the gift of sight to some of Uganda's most remote and underserved communities. With consistency and humility, he travels from village to village, extending eye care services to those who might otherwise go without. Through his community-based organization, he has organized numerous free eye care camps, screened people, and restored hope to families across rural Uganda. Wekwanya leverages his YouTube channel to raise awareness on eye health, share patient stories, and inspire others to take proactive steps toward preventing avoidable blindness.
Ladies and gentlemen, the winner of the Allied Health Worker for this year will walk away with a plaque from the Ministry of Health, a gift hamper from Inspire Africa Coffee, and a cash prize from Stanbic Bank worth 500,000 Ugandan shillings.
Before I announce the Allied Health Work of the Year, allow me to thank the organizers for including the two cadres that support our preventive and promotive services at community level. And I would like to also add and make a personal contribution of 1 million shilling to each of the choose that made it to the finalists. That is three of them. Each will get 1 million, and also 500,000 to each of the VHTs that have made it.
Sir, please cut them. Say it again. They didn't hear. Those claps didn't hear. So
I
each
said,
person,
I thank the organizers for including the two cadres that support our promotive and preventive service delivery at community level. And I would like to make a personal contribution to each of the community health extension workers who have made it to the finalists, three of them, each getting 1 million, and to each of the VHTs, each getting 500,000.
A round of applause, ladies and gentlemen. He said a personal contribution. This he can even do now via mobile money. A number.
Now the winner for the Allied Health Work of the Year is Ambrose Wekwanya.
Congratulations to the Allied Health Worker of the Year, Wekwanya Ambrose.
Sunrise, I will never leave your side. I will never, never. I dedicate my time to you, my guy. Even if the road be rough, I don't mind. 'Cause you be my G for life.
As I never see you online, did they worry me and did they give me consign? Yeah, I be ringing on your cellular. Where you at? Nobody know if you settle down. Yeah, I'm hoping you're okay. We got to party tonight. Many just stay for mine. Yeah, me and you feel like they're not my guy. Don't jazzy, my guy.
Congratulations to our winner, Ambrose.
So I call your name when I ask me.
Banange, DJ. Yeah. Sir, please, the microphone. I don't deny people with money.
Thank you very much for giving me this opportunity. I'm very happy for the winner. This is one of the new cadres that Allied Health has just put on board. He's an optometrist. An optometrist, there are only 47 on the register, and he's one of them who has taken the award. So, as the Register of Allied Health Professionals Council, I add on the 500 from Stanbic Bank, I add on 1 million.
Banange, clap like it's yours. Clap. Thank you so much. Anyway, yes. I've given you a cow. Someone. I had someone. Right. My amazing, fantastic, great audience, allow me give you this opportunity to be serenaded by a talent from straight here in Africa, Uganda. She's a young, very young, by the way, beautiful vocalist, and she's going to sing straight from the diaphragm. I heard her practicing last night. Ladies and gentlemen, a round of applause for the beautiful, talented Praise.
Amazima
Good evening, everyone. Protocol observed. My name is Praise Wisdom. Thank you for coming. Enjoy.
amazima dala nchima mani mtunula jawanze ja abalala jawabaleka onwanira echalo abalabe sebaleta kala na weba imuka namukama woli sitia sinsonga yitina sine na manyi and singing on. Can you 마찬가지한 예 야배 사와로 고서 세천은 좀한데 해라 사본 야배 식시와 말라라 사보 고세세 오분어먹왕해 여전히 나만이 오고서 세빈했네 Wonderful when people meet down in Africa, the land of the sun. We sing under the dance of the moon. I was born in Africa. Sing my song, music African. I was born to sing. I feel the music, the singing song, and I was born to dance. I'll be the rhythm, the singing drum.
hope everyone loves it. You can stand up and dance with me if you know the song.
Girl beat.
When I come out, when you want, hello, sun.
Thank you.
Ananga, you, what are you doing with your life? Praise. Everyone is asking me, but how old is that girl?
I'm 16.
16 years old and you have a voice like that. Well done, Praise. Your parents named you rightfully so. But the DJ always says, if it's night, play it twice. So to wear your one last a cappella, just random, just a verse on your chorus.
Oli moja wa musaja singa, oli moja wa musaja singa nze, oli moja wa musaja singa, oli moja wa musaja singa nze.
Sija musanga. Yeah. Minister again say, Anange Somalia. Well done, Praise. Congratulations to you. To everyone that joined us in dance, the after party, that was just rehearsal. We have an after party after here. Now, let's get back into these categories for the awards. And for our next category, we are awarding the Media Excellence in Health Awards. I would like to invite Dr. Anthony Lord Basing, the CEO, Incast Diagnostics, Ghana, to give us the honor of giving out this award. Dr. Anthony Lord Basing, CEO, Incast Diagnostics, Ghana. Oh no, did he step out? We saw him. And the nominees are
Aloysius Byamukama. Aloysius Byamukama is a passionate and committed health journalist whose work has significantly contributed to public awareness on critical issues. Through impactful storytelling and consistent coverage, he has helped communities better understand and engage with health services. His openness to collaboration and strong network within the health sector makes him a valuable resource for fellow journalists. His social media platforms have become powerful tools for health communication, reaching thousands with each post and amplifying key health messages across Uganda. Walter Mwesige. Walter Mwesige is a results-driven Ugandan journalist with more than 10 years of experience in impactful storytelling focused on health issues. His work champions community development and policy change through compelling evidence-based reporting. Mwesige's health stories regularly feature on NTV Uganda and its sister publication, The Daily Monitor. His reporting consistently highlights innovative health solutions, amplifies community voices, and promotes dialogue around sustainable development. He continues to shape narratives that advance health, influence policy, and inspire action across Uganda and beyond. Razia Athman. Razia Athman is an award-winning journalist and multimedia news producer at Vision Group with a distinguished career that includes serving as Deputy Editor-in-Chief and Head of the English edition at Africa News. She has also worked as an international correspondent for TRT World, Africa News, Euronews, and reported for the BBC World Service under the Africa Partnership Project. Athman's journalism has consistently spotlighted healthcare innovations, bringing global attention to transformative solutions such as the Pedotop, Mescan Uganda, the Stroke Early Detection Device, and Wekevede.
That's a very powerful group right there. Those are my people in the media. Allow me to invite Dr. Joseph Okwari, the Director of Governance in the Ministry of Health, to give us the honor of giving out this award. This is the Media Excellence in Health Award. Dr. Joseph Okwari, thank you so much, sir. The winner of this award will walk away with a plaque of appreciation from the Ministry of Health, as well as a gift hamper from Inspire Africa Coffee and a cash prize from Stanbic Bank worth 500,000 shillings.
Media Excellence in Health Award. The winner is Aloysius Byamukama.
No.
Oh, you came ready to win an award.
Take a good sweet medication.
Congratulations to Aloysius.
Kusinga bati nsomose emiga mingi nganonya masine first aid. Hakuna dawa, baby you're the only one dawa. Hakuna dawa, otali moyo gunuma. Hakuna dawa, baby you're the only one dawa. Hakuna dawa, otali moyo gunuma. Kati bojo, chikole bojo. Tabula dagala mumpiso bojo. Tunola mufometa moma doctor. Kamata fomite daga. Mumpiso jikwata bulundi doctor.
A big congratulations to our winner, Aloysius, who's walking away with the winner of Media Excellence in Health. This is the Heroes in Health Awards 2025. Congratulations. I never he's not sharing the money. All right, for our next award, we're moving on to Outstanding Nutritionist of the Year. And I would like to invite the Undersecretary, Ministry of Health, Republic of Sudan, Honorable Dr. Kennedy Ganiko Clement. The Undersecretary, Ministry of Health of the Republic of South Sudan, Honorable Dr. Kennedy Ganiko Clement. And thank you so much, sir. And the nominees are
Regina Nantege. Regina Nantege is a visionary nutritionist, entrepreneur, and mentor whose leadership embodies compassion and innovation in dietary care. As the founder and lead dietitian of Impact Nutrition Company, she has redefined access to nutritional therapy through digital and on-site services, ensuring that no one is left behind. Through her guidance, countless individuals and families have achieved better blood glucose control, improved blood pressure, healthy weight management, and sustainable lifestyle choices. Nantege continues to empower Ugandans to live healthier and more fulfilling lives. Daniel Kamara. Daniel Kamara is a passionate advocate for nutrition and preventive health. As a clinical and community nutritionist at Bundi Community Hospital and managing director of the Nutritional Rehabilitation Center Uganda, he has touched over 20,000 lives through education, counseling, and outreach. As a board member of the Allied Nutritionists Association of Uganda, his leadership continues to influence food systems, public health, and community well-being. His message is simple yet powerful. Good nutrition is self-care, the foundation of a longer, healthier life. Simon Ondoga. Simon Ondoga stands out as one of Uganda's most dynamic and results-driven nutritionists. His expertise, empathy, and innovation have reshaped nutrition and public health. He has transformed countless individual health journeys while contributing to national initiatives to improve dietary standards and reduce malnutrition. A thought leader and advocate, Ondoga regularly contributes to academic discussions, media forums, and public health dialogues. His dedication continues to inspire a generation of nutrition professionals and healthier communities nationwide.
the winner of this award will go away with an appreciation plaque from the Ministry of Health, a gift hamper from Inspire Africa Coffee, and as well as a cash prize of 500,000 shillings from Stanbic Bank. And the winner is for the
Thank you for the opportunity for me to announce the winner. The Outstanding Nutritionist of the Year 2025 is Daniel Kamara.
big congratulations. Congratulations to our outstanding nutritionist of the year, Daniel Kamara, 2025. He's winning himself a plaque of appreciation from the Ministry of Health. A gift hamper from Inspire Africa Coffee. A gift hamper as well. A cash prize of 500,000 shillings from Stanbic Bank. Hey, the gifts are many. Look for more hands. DJ, this one, I
I also want to announce this one with us. Ladies and gentlemen, in addition to the 500,000, I have been given the honor to announce on behalf of the Ministry of Health, the Republic of South Sudan, have given you another 1 million Ugandan shillings. Follow him, he's the one with the money, not me. Not me, follow him. What's center again? Omugaga again, dabanake. All right, for our next award, we are giving out an award for the Self-Care Champion of the Year 2025. That award is we're going to give this honor to Dr. Lillian Sekabembe, the country representative for PSI Uganda. Please give us the honor of giving out this award for the Self-Care Champion of the Year. And the nominees are
Alafat Mugira. Alafat Mugira has built a vibrant fitness culture in Jinja City. He leads daily jogging sessions and workouts along Chavazinga Road and Bugembe, inspiring others to adopt active lifestyles. Throughout the COVID-19 pandemic, he modeled discipline and resilience by adhering to public health measures while motivating colleagues and youth to do the same. His influence extends into schools, where he leads health education programs on mental health, reproductive health, nutrition, and disease prevention. He has inspired a national culture of health ownership, encouraging young people to take responsibility for their well-being and build a healthier, more productive Uganda. Mary Namkisa. Mary Namkisa has redefined community wellness through her tireless advocacy for physical activity, nutrition, and preventive health. During the COVID-19 pandemic, she founded a free community workout group in Lubaga, empowering residents to adopt exercise and healthy eating as tools to combat non-communicable diseases. She leads childhood cancer awareness initiatives in Western Uganda, mobilizing resources for treatment and early diagnosis. Her efforts have doubled the number of children diagnosed annually, ensuring that more young lives get a chance at recovery. Precious Mutoro. Precious Mutoro has been at the forefront of institutionalizing self-care in Uganda since the launch of the WHO self-care guidelines in 2019. As Senior Manager for Advocacy and Partnership at PSI Uganda, she has led national efforts to transform self-care from concept to practice through mobilizing partners, resources, and policy action. Under her leadership, PSI Uganda served as the Secretariat of the National Self-Care Technical Working Group, coordinating consultations, piloting interventions in Kono District, and building consensus across government, civil society, and development partners.
Right. Ladies and gentlemen, the winner of the Self-Care Champion of the Year award goes away with an appreciation plaque from the Ministry of Health, a gift hamper from Inspire Africa Coffee, as well as a cash prize of 500,000 Ugandan shillings from Stanbic Bank. Are you ready, Doctor?
I have the honor to present the Self-Care Champion of the Year award to Precious Mutoro.
A very personal award. Precious, come running. This is a big, they work together. She is in her one of her team members. Congratulations to you, Precious.
So anyway, come and go. I am gonna man a gumpalo. Who do you wait to get to pass? So come see your baby mama eat a triangle. I am in the mood. Can I see you tonight? See you tonight. Wagala baby for life. Baby for life. I can't go there tonight. See you tonight. Make you go there for life. Baby for life. Okatamiro gojo wakandida.
us who is the self-care champion of the year. She wins herself an appreciation plaque from the Ministry of Health. This is the Heroes in Health Awards 2025. A gift hamper from Inspire Africa Coffee and 500,000 Ugandan shillings from Stanbic Bank. This is a very special moment for also Dr. Lillian. That is one of her team members at PSI. So another round of applause because they must be doing great work there. Precious, use this opportunity to ask for a raise. Yeah.
Now, ladies and gentlemen,
All right, our next category is the Mental Health Champion Award. I would like to kindly ask Dr. Joy Batusa from CHAI, CHAI, to give us the honor of giving out this award. Dr. Joy Batusa. And the nominees are
George William Semakula. George William Semakula is a psychiatric clinical officer at Butabika National Referral Hospital, where he has earned deep respect for his integrity, empathy, and professionalism. Semakula is known to safeguard his clients' trust, ensuring their well-being and protecting their property with utmost integrity. His humility, faith, and humanity have made him a role model to his peers and a source of comfort to countless patients and families. To his colleagues and clients, he's a God-sent healer, a quiet pillar of hope and integrity in Uganda's mental health service. Thomas Walunguwa. Thomas Walunguwa is a mental health professional and principal psychiatric clinical officer whose career spans more than 30 years of dedicated service. He began his journey at Butabika School of Psychiatric Nursing and later advanced as a psychiatric clinical officer, serving at Butabika National Mental Referral Hospital and later at Masakari General Referral Hospital. Between 2004 and 2016, Walunguwa led mental health outreach programs across Masaka, Lwengo, Kalungu, Bukomansimbi, Rakai, and Sembawle, transforming access to mental health services for rural communities. Yusuf Kule is a pioneering mental health practitioner whose foresight has transformed access to psychiatric care in southwestern Uganda. With more than 25 years of service, Kule began his career in 2001 at Kisisi Hospital and now serves at Windi Community Hospital. Recognizing the limitations of hospital-based care, Kule spearheaded the Community Mental Health Service, an initiative that has reached more than 20,000 patients and their families, providing essential treatment, education, and psychosocial support.
Ladies and gentlemen, the winner of this award will walk away with a plaque from the Ministry of Health, an appreciation box for gift hamper from Inspire Africa Coffee, as well as a cash prize from Stanbic Bank worth 500,000 shillings.
Good evening, ladies and gentlemen. The winner for the Mental Health Champion Award 2025 goes to Semakula George William.
A round of applause for Semakula George William, who is the Mental Health Champion Award winner 2025.
Chérie, oh, give me overdose. Reste près de moi, be my daddy, là. Hallelujah, hallelujah. On ne sait jamais so that I don't miss me, oh, nah, nah, oh yeah. I am so down. to be my Wonder Woman. Yeah, me better but then me zippy one.
Next award, which is the Student Innovation Award. For this award, I would kindly ask the Director of Program Management at the World Health Organization Regional Office, Dr. Diallo Abdurrahmane. He is the Director of Program Management at the World Health Organization Regional Office for Africa. That's Dr. Abdurrahmane Diallo. So, how do they say your name?
Abdurrahman Diallo.
So I didn't get it wrong. Dr. Abdurrahmane Diallo. Ladies and gentlemen, the nominees are...
Bernard Owori, as Guild Minister for Disability Affairs at Mbari University of Science and Technology, Bernard Owori spearheaded a sign language training initiative that drew more than 250 applicants, amplifying inclusivity and awareness for persons with disabilities. He co-founded Nexagen Chemicals and Therapeutics, a pharmaceutical startup that won the 2023 Startup Africa Inter-University Pitch Challenge. He has established the MAST Medical Research Club, nurturing young innovators and researchers. Joel Felix Ochom, now founder of Maisha Medicine, Joel Felix Ochom's life was saved from severe malaria by a traditional herbal remedy at 14 years of age. That moment ignited his lifelong mission to bridge traditional medicine and modern science to deliver affordable and effective healthcare. Today, Maisha Medicine stands as a beacon of that vision, validating and scaling local herbal solutions. Ochom is redefining what it means to innovate in Africa, to heal, preserve, and empower communities through the strength of their own knowledge. Julius Kalumba. Julius Kalumba is a final year student of pharmaceutical sciences at Mbari University of Science and Technology. His ingenuity and perseverance have turned personal inspiration into a nationally recognized innovation. His creation, Go Pain Liquid Balm, is a quadruple therapy formulation that relieves joint and muscle pain, headaches, and nasal congestion. Developed initially in his hostel room to ease his mother's chronic joint pain, Go Pain has since won the CITT commercialization seed grant, propelling Kalumba's innovation into a public health application.
Ladies and gentlemen, the winner of the Student Innovation Award walks away with a plaque of appreciation from the Ministry of Health, a gift hamper from Inspire Africa Coffee, and a cash prize from Stanbic Bank worth 500,000 shillings.
And it is my pleasure and honor to announce that the Student Innovation Award winner is Ochom Joel Felix.
Ochom Joel Felix, congratulations.
I'll be on the phone, calling you tonight. I wanna make you show me, make we know the fight. I don't wanna sleep alone, wanna hold you tight, but I fool my eyes, but I'll be alright. Forever, on my laptop, on my keto, on my sheet on.
That's our winner right there, Student Innovation Award 2025. That's the Heroes in Health Awards.
Them go run it down, them go hold it, them go. I'll be talking to myself, and I don't even notice. She got me feeling like a zombie, and she they shoot like Chuck Norris. The way she put her body down, you got me falling truly. I just touched down. When I see you now, I've been on the phone, calling you tonight.
you know, when I do this kapato manye chija. All right.
Ladies and gentlemen, we are really very excited. Felix is from the Department of Pharmacy in the School of Health Sciences, and I'm the dean. I'm his dean, so you can imagine I'm very happy. So I'll also give him 1 million Ugandan shillings.
Those are the educators we like. No, school fees clear. Congratulations to you, our winner for the student innovation. Okay, he has been gifted and he also wants to gift.
Good evening, everyone. Protocol observed. I'm really so happy for this award. Actually, I have 2 products. One of them is currently being used. I'm an intern at Mulago, but we are currently using it. It's a mosquito repellent as one of the integrated prevention strategies. So I would like to give some samples to the Minister of Health and the Permanent Secretary of Health.
A round of applause. Ivanange, your mother did a good job. Well done. Right, we're moving to our next award. Okay, so right now, if you've been fully paying attention, then you know that we only have the Excellence in Health Academia Award, the Maternal and Child Health Care Award, and the Public Health Facility of the Year Award left, correct? Only 3 left. So, for our next category, the Excellence in Health Academia Award, I would like to invite Dr. David Nahamia from the National Drug Authority, from the NDA, to give us the honor of giving out this award. Dr. David Nahamia. And the nominees are...
Professor David Serada. Professor David Serada is a renowned clinician and infectious disease epidemiologist, serving as Professor Emeritus and former Dean at Makerere University School of Public Health in Kampala. He holds degrees from Makerere University and an honorary doctorate from Johns Hopkins Bloomberg School of Public Health. Serada has made significant contributions to HIV prevention with over 400 published papers. In 1985, he was part of the team that reported Uganda's first cases of Slim's disease as an AIDS-related illness in the Lancet. He co-founded and led the Rakai Health Sciences program, which provided vital evidence on the effectiveness of antiretroviral therapy and demonstrated that circumcision reduces the risk of contracting HIV. Professor Nelson Sewankambo. Professor Nelson Sewankambo is an emeritus professor of internal medicine and clinical epidemiology at Makerere University College of Health Sciences and the president of AfriHealth. He is a fellow of the Royal College of Physicians, the London School of Hygiene and Tropical Medicine, the US National Academy of Sciences, and several other prestigious bodies. He received the Grand Silver Medal from the Karolinska Institute in Sweden. With over 35 years of HIV research experience, Sewankambo co-founded the Rakai Health Sciences program, which was instrumental in identifying Uganda's HIV/AIDS epidemic and advancing global understanding of the disease. Dr. Moses Kamya. Dr. Moses Kamya is a distinguished Ugandan physician, academic, and researcher with over 25 years of experience in infectious diseases. He is a professor of medicine at Makerere University and the executive director of the Infectious Diseases Research Collaboration in Uganda. Recently, he was awarded the Makerere University Vice Chancellor's Research Excellence Award in 2024 and 2025, recognizing his prolific publications and contributions to health research. Kamya's efforts have significantly advanced infectious disease research and health capacity building in Uganda and East Africa.
very, very, very powerful award, just like every other award. This is the Excellence in Health Academia Award. Now, I have been reliably informed that Dr. David Nahumia is not available. So he sent his best people, Ms. Maureen Naluima and Mr. Abiaz Ramwiri, to represent him ably. And for this award, interestingly, we have 3 winners.
So I have the honors to announce Professor Nelson Sewankambo.
Yes, protocol observed. The award goes to Professor David Serada.
The last, Dr. Moses Kamia.
Now, I also want to take this opportunity, DJ, to let you know that this award comes with a cash prize from Stanbic Bank for each one of them at 1 million Ugandan shillings. Plus the plaques from Ministry of Health and the gift hampers from Inspire Africa. These are very important professors. Thank you so much, professors. Thank you, thank you, thank you. Before we give out the award, prestigious award, and before we even do the handover, because I'm going to add a few more people, I was kindly asking the professors to just say something small, not so? Yes, respectfully, just to encourage us for all the work that you've done. True excellence. Thank you so much, Professor.
Thank you very much. I'm really honored to receive this award, more so from the Ministry of Health. I have received many awards in my life, as far as Kuwait, and yet, for back home here, it is so different to get an award from your own country, for your own work. So I really recommend the opportunity the ministry has taken in to appreciate its colleagues in academia or in health service delivery for what we do for not only Uganda, but for the rest of the world. I thank you very much. I'd like to thank all my colleagues. This award really, research is a team effort. And I would like to recognize all my colleagues in Makerere University School of Public Health, in Rakai Health Science Program, and the communities where we have been doing work for the last 14 years, for the opportunity to work with them to be able to impact on people's lives. Thank you very much.
Ladies and gentlemen, this is a very exciting moment. When I was considering coming up here, I wanted to come dancing. But wisdom prevailed and said, hey, don't create emergencies here. This moment is extremely, extremely valuable to me. I didn't retire from Makerere University officially, and at the time of 2 months to retirement, they sent me an invitation to become an emeritus professor, remain with Makerere for as long as I wish, but with no salary. With no salary, I repeat. And I chose to stay because I enjoyed the work that I do or I did in the last 40 years. And so I want to continue doing the good work with all the people to take Uganda and Africa forward. Thank you very much.
Dr. Kamya is not around, but his daughter is representing him ably. Speak on behalf of your father.
Good evening, everyone. My name is Carol Kamya, and I'm delighted to receive this honor on behalf of my father. He's unable to be here today, but he is very excited to receive the award. And I can't speak enough of his passion for research in HIV, TB, and malaria, and also for his passion in capacity building. I wish to thank the Ministry of Health for honoring him in such a great way. We don't take it for granted because he has been honored outside of Uganda, but it feels different when it comes from your country. Thank you again.
I would like to take this opportunity to invite Honorable Dr. Ruth Acheng, Jane Ruth Acheng, and our permanent secretary, Dr. Diana. You said you're already coming, so we're now going to do the handover. Please, if you can hand over the awards ceremony. Congratulations for all the work they have done in academia. A round of applause to our professors and doctors on the stage. We have the Maternal Health and Child Care Award. I would like to invite Ms. Diana Ondaga from Stanbic Bank to join me again to give us the honor of giving out this award. Ms. Diana from Stanbic Bank. And the nominees are
Dr. Olive Sentumbwe Mugisa, Dr. Olive Sentumwe Mugisa, a distinguished Ugandan medical doctor and obstetrician gynecologist, has dedicated over 30 years to advancing maternal and child health. Since graduating from Makerere University in 1990, she has demonstrated visionary leadership and innovation in strengthening reproductive, maternal, newborn, child, and adolescent health. Mugisa's influence spans policy and program innovation, having guided the development of essential maternal and newborn care guidelines, family planning training packages, and strategies promoting male involvement, self-care, and integrated sexual and reproductive health and rights. Sophia Otema. Tucked deep in the fishing communities of Amolata, Sophia Otema has spent more than 10 years bringing life safely into the world. A midwife at Abrotech Health Center 3, mothers speak her name with gratitude and reverence. Fathers say, with Sophia, you are safe. Many children now bear her name as living tributes to the woman whose calm hands and steady voice have guided so many through the storm of childbirth. Through malaria seasons, supply shortages, and sleepless nights, she has remained at her post, faithful and deeply rooted in service. Dr. Loy Biaruhanga. Dr. Loy Biaruhanga, a pediatrician at Kawempe National Referral Hospital, has transformed the neonatal unit into a nationally recognized model of excellence. Through hands-on mentorship, she has cultivated a highly skilled and confident team of nurses, midwives, and junior doctors championing best practices in maternal and newborn care. She trains healthcare workers from across Uganda who seek capacity building in neonatal and maternal health. Under her guidance, the unit has achieved remarkable survival rates among critically ill and referred newborns.
For this award, for the award for the Maternal and Child Healthcare Award, the winner will walk away with an appreciation plaque from the Ministry of Health, as well as a gift hamper from Inspire Africa Coffee, and a cash prize from Stanbic Bank worth 2 million Ugandan shillings.
Ladies and gentlemen, distinguished guests, the winner is Dr. Olive Sentumwe Mugisa. Congratulations.
Dr. Diana, if you could join here. It's a very important moment. Akakaimba Dr. Diana said yongeza volume.
lwaki mama mama ndikwebaza ntya omukwano gwa mama tegusangika mama wazuukuka n'ekiro ensirirwe zisse mama natewana bambi nabika wakiri yatunula n'akeesa gwe weebaka emirembe oyo ye mama.
Thank you very much. I think I want to thank the Lord who has provided this day for us. It's a great, great day. I feel very excited. I want to thank the Ministry of Health colleagues because we've moved through the thick and the thin for mothers and what? And newborns, for adolescents, for everybody to make sure that they are healthy. I'm happy to have received this award. I'm very excited. Thank you, all of you, because I think in one way or another, each of you has put a prayer, a wish, so that this day can be realized. Thank you very much.
Congratulations to our winner.
This is the day that the Lord has made, that the Lord has made. I will rejoice and be glad in it, and be glad in it. This is the day that the Lord has made. I will rejoice and be glad in it. This is the day that the Lord has made. This is the day that the Lord has made, that the Lord has made. I will rejoice.
Congratulations to Dr. Olive. Thank you so much for all the work that you're doing in the maternal and child health care. Our last award of the night. Let's first high five each other. High five. High five. There we go. There we go. By the way, jokes, we have 5 more. I'm kidding. 1 more. Our final award of the night. The category is the Public Health Facility of the Year. And I would like to invite Mrs. Atukunda Tugume, the Director for Inspire Africa, to join us on the stage. We do have honors awards after this, but this is the last for the ones that had nominations. So if we could kindly have Mrs. Atukunda Tugume. Ladies and gentlemen, and the nominees are
Public Health Facility of the Year, Bukasa Health Center 4. Bukasa Health Center 4, located in Kalangala District, offers a wide range of essential health services, including laboratory testing, dental care, outpatient and inpatient services, eye care, antenatal and postnatal care, family planning, and immunization. The operational theater at Bukasa has been a game changer, saving lives and easing the financial and physical burden of referrals to distant mainland hospitals in Masaka and Kampala. This has brought safer and better healthcare closer to the people. Beyond its walls, Bukasa Health Center 4 extends its impact through outreach programs, including mass immunization campaigns and health education initiatives. Using boats to reach remote islands such as Bufumbira, Bubeke, Mazinga, and Chamswa, the facility ensures that even the most isolated communities on Lake Victoria receive vital health services.
Right, the winner of this will go away with a plaque of appreciation from the Ministry of Health, as well as a gift box from Inspire Africa Coffee. Ladies and gentlemen.
And the award for Public health facilities goes to Bukasa Health Center.
Congratulations, Bukasa Health Center. Ladies and gentlemen, Bukasa Health Center.
China kushana na bushana nyumba okukama ndimusanyufu ngabona ndebazamukama olw'obulamu bwenyina buno ati nkukubira ekigoma kyakusayima erikezo nekusayibwa muzege nayisa simasaka bandi bro. Would you be like to give me my dream? Love me baby, baby love me 60 what you love you decided to love me baby baby. You decided to touch me very well. If you touch me very well,
There we go. Congratulations. Well done.
I will touch you very well.
Congratulations to Bukasa.
I'm a bit afraid. Why can't you explain? Problem in all the finish. We can try to enjoy. Wahala in all the finish.
All right.
Mr.
Abiaz Wamiri, you had a message for the media. Where's Mr. Abiaz Ramiri? Ah, there he is. He had a small message for thee. So are the nominees for the media category still here? Razia, are you still here? Put up your hand. The nominees? Ah, here he is.
As the spokesperson of National Drug Authority, media helps us in simplifying our message and transmitting it to the public. So media is very key in the work we do. And when two of my colleagues were nominated who did not make it to the stage, as NDA comms team, we'll give each one of them the same money that the winner got, which is 500,000, each one of them.
A round of applause, each one of them. That means that Razia and Walter will also walk away with 500,000 shillings each. Everyone is a winner. Now I believe it when they say, even being nominated, you are a winner. This is how I believe it. I'd like us to turn our attention to the screens right now for us to appreciate some of the works from the Ministry of Health of Uganda.
For decades, seeking advanced healthcare meant leaving home, family, and country for many Ugandans. But today, a new era of health is here. A transformation is underway. From world-class organ transplants and neurosurgery at Mulago to comprehensive care at the Uganda Cancer Institute and advanced heart procedures at the Uganda Heart Institute, world-class specialist care is now available right here at home. This progress is just not in Kampala. Hospitals and health centers across the country, from regional referrals to Health Center 3s, are being built, expanded, and equipped, bringing quality care closer to every Ugandan. Emergency medical services now cover 64% of Uganda. Hundreds of ambulances on roads and lakes have been deployed. By December 2025, a universal emergency code will be availed to receive emergency services in one go. We are now shifting from treating illness to preventing it. Our new generation of community health extension workers brings health education, early screening, and care right to your doorstep. Digitization is connecting health facilities and patient records for faster and smarter service delivery. To date, over 400 health facilities use digitized patient medical records, and with the national medical stores ensuring regular, reliable supply of essential medicines, no Ugandan should be left out. Every year, over 400,000 units of blood are collected through donation drives around the country, fueling emergency care, surgeries, and maternal health. Every donor is a hero. To protect every Ugandan, the National Drug Authority ensures that all medicines and health products are safe, effective, and of the highest quality. From pharmacies to hospitals, the safety of what we use is guaranteed. But the most important partner in this transformation is you. As government invests in hospitals and innovation, your well-being remains your responsibility. Eat a balanced diet, exercise daily for at least 30 minutes, avoid smoking and drinking excessive alcohol, go for regular checkups and screenings at the nearest health facility. Ensure that all children are immunized at least 9 times before their second birthday. From super specialized hospitals to strengthened community health, Uganda is building a healthier, stronger future for all.
Well done. A round of applause, please. I'm true. Honorable. You're now using that table, eh? What to do? Clap your hands, bang the table, shake the table, move things. Yeah, take off shoes. Kill me, that's so funny. I'd like to take this opportunity to give a special recognition to the Ministry of Health. The Ministry of Health extends special recognition to the outstanding team behind the creative documentation and profiling of the health sector achievements compiled in the previous video and books before you. Those books were really good. This dedicated team, Abirami Kananathan, Kzibwe Tony, Kasule Mohammed, Grace Apolot, and Sekamate Wilson, have worked tirelessly, often under immense pressure, to ensure that our story is captured with accuracy, clarity, and visual excellence. Their commitment, teamwork, and exceptional creative skill have powerfully showcased the ministry's impact as we account to the public. For the next awards, I would like their special recognition awards that are being given to these ministers. And I will call their fellow minister, Honorable Dr. Jane Ruth Chen, to join us on the stage to give out the Minister Special Recognitions Awards. We are going to start off, but before we give out to the ministers, we would like to first appreciate Abirami Kananathan. Please come join us and receive your gift, Abirami. We also like to appreciate Kiziwe Tony. Please join us as fast as possible. Kasule Mohammed, Grace Apolot, Sekamate Wilson. Please join us on the stage. A round of applause to this team. They might not look like it, but they have had sleepless nights. They look like they just woke up. So fresh and so clean. Congratulations and thank you so much.
Sweet melody.
From Inspire Africa Coffee.
This
to start off with two very special people for the Minister's Special Recognition Award, Mary Nabosa and Professor Moses Galukande. If you could join us, a round of applause for them. Special recognition for the work they have done in the health sector. There we go. I am Mary, that's how they do it.
Kosa budodo kumbabula babula buliro nebolita kulwemiseke lafu yote linzigwa kumeme ensine bwezindi bwensekere ndi kusala kaweke nofuna mnyerere yasunze kosa olwalelo lwange baby kosa jangweno cheze nange kosa unyenya mufune dembe kosa
A round of applause. Congratulations and thank you so much. We have one left. Thank you. You may take your seat. Honorable, you're still with me. One last one. Thank you, Mr. Bossa. All right. Thank you. We have another one last one. An appreciation and an honorary award and special recognition. And this is going to be given to Dr. Cedric Akwesije. He's surprised. Dr. Cedric, you don't know that you're hard work?
Today, we pay a heartfelt tribute to Dr. Cedric Akwesije, a visionary leader whose courage, determination, and unwavering belief in Africa's potential have been instrumental in shaping the future of healthcare on the continent. As co-founder of Microhem Scientifics, established in 2012, Akwesije dared to imagine a future where Africa would not just import medical diagnostics, but would produce them locally with excellence, integrity, and innovation. His bold vision challenged conventional thinking, transforming MHS from a supplier of medical equipment and laboratory supplies into the first IVD manufacturing facility in sub-Saharan Africa, a milestone that has revolutionized diagnostics across the region. Under his visionary leadership, MHS has reached significant milestones that continue to impact Africa's health landscape. The company has expanded access to reliable and affordable diagnostic solutions, reaching millions across the continent. Akwesije championed the Africa Health Agenda, aiming to reduce medical product importation to 40% by 2030, thereby fostering self-reliance. His efforts have created over 10,000 jobs, uplifting families and strengthening communities.
Now you can see. There we go. Congratulations to you, to Dr. Cedric Akwesije. Thank you for all the work. Round of applause. There we go. A beautiful surprise for him. Thank you so much. Thank you.
People say she's crazy, she got diamonds on the soles of her shoes.
You may take
Well,
your seats.
that's
Thank
one
you
way
so
to
much.
lose these walking blues. Diamonds on the soles of your shoes.
I'm so surprised, and you almost raised my blood pressure. But I just want to say one word. We are coming. Africa, we are coming. Just dress up, we are going to the world. We are ready. Thank you.
Just dress up. Simply. A round of applause for the hostess with the mostest, the greatest host ever, Honorable Dr.
People say she's
Jane
crazy,
Ruth
she got
Acheng.
diamonds on the
Now
soles of her
that is the host.
Well, that's one way to lose these walking blues. Diamonds on the soles of your shoes. She was physically forgotten, but then she slipped into my pocket with my car keys.
Hey, no go yet. Mama, guys, guess what? Mujukira earlier, yeah? The husband had left. He has come back. I just want to let you know, they didn't leave me on the Luja. I am going to Mogadishu very soon. We're going to take a short break. We have only one speech left, of course, with our amazing host. But she said, let's first have a bit of dance and entertainment before she comes and crowns it all off. Is that okay? Okay, so I would like to take this opportunity to bring them back with the same vigor they brought. Ladies and gentlemen, it is the Ghetto Kids.
You're a good soldier, choosing your battle. Pick yourself up and dust yourself off and back in the saddle. You're on the front line, everyone's watching. You know it's serious, we're getting closer, this isn't over. The pressure's on, you feel it, but you got it all, believe it. When you fall, get up, oh, oh, and if you fall, get up, eh, eh. Tamina, mina, sangalewa, 'cause this is Africa. Tamina, mina, eh, eh, waka, waka, eh, eh. Tamina, mina, sangalewa, this time for Africa.
Drop exploding with some more, nigga. Hey, daddy, nigga, show man. What you say, man? Kaba, 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 kaba,
kaba 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 tamya nsingo teme nsingo fumita nsingo kimenye kwa nsingo kakasa lubimbo toka kuyo siwubo watazina kwachinga chakute mujiro kaba 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 tamya nsingo teme nsingo fumita nsingo kimenye kwa nsingo kakasa lubimbo toka kuyo siwubo watazina kwachinga chakute mujiro yakukuma kakube kukoka yakukoka ndipatiruba chitumbua konka uyo tomunoma kenkami tewepista fashionista tewepike bibibabikuka terikuda terikuba tewakuta ulita wempita dadi mobida dadi mani ninachemani dadi dagachomani mami wechusemba kaba 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 saba 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 kaba 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 tamya nsingo teme nsingo fumita nsingo kimenye kwa nsingo kakasa upimbo toka kuyo siwubo watazina kuachinga chakute mjiro.
Let's change the side. 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 This side.
Tamya nsingo teme nsingo fumita nsingo
even this side.
nsingo kakasa lupimbo toka kuyo siwubo watazina kuachinga chakute mjiro.
In the morning,
I was still enjoying Ghetto Kids. Ghetto Kids, ladies and gentlemen, a round of applause. Lovely outfits. I was still enjoying that. I always love to do a check-in. How are you doing? How are you doing? You're fine? How are you doing? Yeah, mulimutia. I'm kidding. I'm happy to see that you still have smiles on your faces. We're still so early. So, are we ready to rise on our feet? And in the bestest way, because she has had the most energy for everyone. It's our turn to feed her, right? So we are going, protocol observed. I have to invite the person to invite her, but we are going to give them both the same energy. Sindio? And we have Kenyans. You know Kiswahili. Unaongea Kiswahili. Unajua? Ay, okay, sawa. Not so? So. I like that. So, ladies and gentlemen, we need to give the biggest rahahu for our host, who is going to be invited by our permanent secretary, Dr. Diana Twine, who is going to take the opportunity, protocol observed, to invite our honorable Dr. Jane Ruth Cheng. I just want to take this opportunity to say, Mama, thank you. Well done, and congratulations. 6 editions and the very first Africa Health Summit. Pat yourself on the back. You've done well. You've done well. All right. Remember that, Ndulu, Dr. Diana, you also give us energy. Tugenda kuwa vibe. Okay. DJ, you're in class. Ladies and gentlemen, welcoming to the stage our permanent secretary for the Ministry of Health, Dr. Diana Twine. Aha, there we go. DJ.
Yole, wano kara kara, jatani choro kamarachi nyono machi nyono kwa. Jayuri ye. Eruma. Yole. Bilili yole. Naking mo peraya. Yole, wano kara kara. Bilili yole. Alawa yawa yo. Yole, wano wara wara. Bilili yole.
Dr. Diana, you know.
Yole, wano kara kara. Bilili.
Ladies and gentlemen, we thank you so much. It has been a long day, but we want to thank you so much for coming. Our guests from outside this country, we are blessed to have you. Thank you for blessing our function by your presence. And I really want to take this opportunity to thank, really, before I invite my minister to talk to us. We, first of all, want to thank the organizers. We have come a long way. We have come a long way. For the last 6 years, we've been organizing this. We see each year it gets better and better and better, and more focused to what we intended to do. So we want really to take the entire Secretariat of HERE Awards, Bills and your team. We are very proud of you, and we thank you so much for the quality that you put in this organization. The second group I want really to thank is the judges. We want to thank you so much that from the time we started with you, the work has been tripling and tripling and tripling, and you have not gotten tired. We know that you are very busy people doing other things, but you give time to sit and go through tens of thousands of nominations to give us the best. Thank you so much for the quality of work you are doing. Thank you so much for your commitment, and thank you so much for being part of these historical activities that really are shaping lives. Because when we look back, the people we gave awards from the start, their lives have not been the same. And we know that for sure, your lives
will never be the same, right from the students to community workers to nurses to doctors. Your lives will never be the same. I want also, in a special way, want to take this opportunity to thank the sponsors. We have been all the time coming to you whenever we have this function, but you have not gotten tired. I want really to take this opportunity to thank the people that started with us and up to now they are with us. And for that reason, I want to say, for Ministry of Health is eternally grateful for your commitment to walk this journey with us. NBS, you started with us, you are still with us. We want really to thank and take our appreciation to the MD of NBS, because they've been with us even as we are preparing in the preparations, as sending out the messages. You gave us a platform. We are very grateful. I will not mention everybody because the list is there. And we want really to get as many people to support this because it is the right thing to do. It is the right thing to do. It makes lives of these people better because when they do something and the public is watching, it really gratifies because it's not even individuals, it's just the public that comes out and nominates these people. So it means that whatever you are doing is impacting lives. And so we want to congratulate the awardees and the nominees. We want you to know that Ministry of Health is proud of you and is happy to associate with you. Our professors that have been awarded today and our senior doctors, we want to thank you so much for this journey that you have walked with us, for the contribution, the professional value that you bring to our country. We want to thank our senior doctors that have been awarded today and all other cadres, that your effort is being seen. Your sacrifice is not forgotten. And your commitment is not just being rewarded here, but it will be rewarded even after. You can never give the best to the people of God and God does not reward you back. I want you to know that one. And thank you so much. So awardees, we are proud of you and we really want to, especially the midwife of the year. You saw that joy. The midwife of the year, I will give you 1 million. Yes. I'm so happy to see you from all the way from Padel, that the public recognized you. Thank you so much. So allow me, without saying much, to invite our Honorable Minister to come and talk to us as we conclude this evening session.
Cheers, cheers, cheers for your son. This is for you, Jesus. Just wander on the beat. Let's go. From the moment Jewanonda, Ompa Devirunjera, Montwala Walunjate. From the moment Jena Quikwatan, Eviangerebia Chika, Katindi Mwana wa Mwami. Onkole Devirunjina, Imbonkole Devirunjina, Onkole Devirunjina, Onkole Devirunjina, Vitagambika, I will praise you all my life. Dance for Jesus. Cheers, cheers, cheers for you. Cheers for you. Cheers,
Thank you for dancing for Jesus. Yes, you can go. Excellencies, distinguished guests, I know we are all tired, but allow me to greet you all good evening and to thank you in a very special way for staying from 8 a.m. this morning to nearly 9 p.m., if it is not yet already 9. That's a long day. So I request that you clap for yourselves. Allow me to say that we are honored and we are humbled that you could come and stay for the whole day. May the good Lord bless you all for doing that. This 6th edition of the Heroes in Health Awards is a little special. For me, it is special because I was not supposed to be here. I'm supposed to be somewhere campaigning. But my teams in the ministry made sure that I am here by saying, be here. And so I am here. I have enjoyed myself, and I hope you have also enjoyed yourselves. Congratulations to all the awardees. We are super proud of you. And congratulations to all the nominees. You did not lose. You did not lose. You were nominated because you are excellent. And that is why you were called, because you are excellent. You are serving excellently. But not everybody can win. There is usually a winner. And so I also want to say congratulations to you and thank you for working very hard to transform the health system. Every year, Hiha reminds us that behind every statistic in our report is a life saved, a child vaccinated, an NCD that has been treated, and so on and so forth. That is what we trained to do. From the community health worker, that is the village health team, to that excellent doctor somewhere. We all work as a team and we complement each other. No one is better than the other. We are one. And we only have one goal, and that is to ensure that we have a healthy and productive population, so that we can achieve what we all want to achieve, and that is a healthy Uganda. So I want to thank all of you for working very hard, for transforming the health sector, for remaining committed to the health sector in spite of the challenges. I know every year we talk about challenges, and many of you keep on asking, when will these challenges be addressed? Every great thing begins with one step, and Hiha is one of those steps leading us in the right direction. This year's Hiha has been a little different because we started with the Africa Health Summit. Because as Africa, we know that we have the answers to our challenges. The reason why we have not solved our challenges is that we have not taken that step in that direction. But there are many people amongst us here who have decided to take the right step in that direction. And many of them are the manufacturers that we had with us today, and one of them we recognized this evening. So it is not only about manufacturing, but it is about all of us working together so that we can achieve universal health coverage and address the issue of financial risk. I want to thank our guests, the ministers from the various countries who came, Africa CDC, the World Health Organization, and all the other institutions for coming to witness what we do in Uganda, but also to be a part of it. You have truly honored us, and we do appreciate. I also want to add my voice to appreciate all the sponsors of the Africa Health Summit and the HIHA. We are truly grateful. We don't take your contributions for granted. I know every year we will knock on your door. Please don't turn your back. However little it is, it matters, because we must continue to tell our health workers how much we value them, how much we appreciate them, and to also make them feel valued and appreciated. One of the questions I asked the chair of the panel was that I have been wondering why you never receive an award. Yet every year you sit and go through the thousands of nominations that are sent to you. And today when he received an award, I was the most excited. You know, you need to be appreciated. So now I'm asking the panelists, what about the other members of the panel? Not even 500,000, not even 100. Only food. Really? The organizers? Anyway, I'm not going to talk too much. Maybe I'm preempting. I hope next year they will go for trips to Mark-Shishons, Queen Elizabeth. I'm just suggesting, but there are others we could do better than that. But thank you to the panel. You always do us proud. Thank you very much. Allow me also to appreciate the organizers. I don't know why some of us are not classified as organizers. They have received gifts, they have taken photographs, they have forgotten me and the PS. So for us, who are we? Anyway, for us, we are us, and we have also enjoyed ourselves. So clap for us also. But the organizers, we are very grateful. Thank you. Yesterday, I passed by here to peep because I wanted to be very sure because this was a new innovation. And I told myself, I don't want to be ashamed because they brought me all the way from Lira. Let me come and see what they are doing. I tell you, I was very impressed. Thank you very much for your commitment. And thank you for running up and down, especially bills. And there is another one. Yes, that one. What did you call him? That one. Those two. Thank you very much. Thank you for your commitment and your passion to Heroes in Health Awards. allow me to say something that made me very emotional. The Lifetime awardees today. And I hope that many of you noticed that because of their hard work, their commitment, and the many years, the majority of them could not climb the steps to come up, so they decided to sit there. And the Right Honorable Speaker, in his humility, decided to go there. Wasn't that beautiful? Really beautiful. But congratulations to the Lifetime awardees. You deserve it. You truly deserve it. And our teachers, I know many of you in this room were taught by those three who came here, who were escorted by Dr. Magino. Dr. Magino, have you received an award? Can you imagine? But you make a very good best man. You did a good job today. Thank you for escorting our teachers. Maybe the panelists will remember you. But you know the voters to come from the Wananchi. So you have to talk to me nicely so that I nominate you and others vote you. And then the panelists will remember you. But receive an award from my mouth. I award you. It is late. It is time for us to go. With all the appreciation, I want us to stand up and I close with a word of prayer. If it is okay. Is it okay, ma'am? Because when I pray, we are leaving. You know, young people never get tired. She has just whispered to me that I tell you don't go away, there is a cocktail. I don't know. I am just a messenger, don't crucify me. She has also whispered that we are going to have group photos. She also whispered that there is going to be a dance till morning. I'm not part of it, but I am a messenger. But she has allowed me to pray. And after prayer, you take a seat. That's what she said. You know, the MCs are very powerful. And this lady is very powerful. She's super smart anyway. So, and she worked the whole evening. By the way, can we appreciate her? You did a good job, and we appreciate. Let's pray. Loving and faithful Father, we thank you for this day, the 14th day of November 2025. We want to thank you for gathering us here as a family, together with all our guests, for the Africa Health Summit, and to recognize our heroes, the health workers, who tirelessly commit themselves to save lives. We thank you, Heavenly King, for blessing us abundantly today, keeping us fit and strong, providing our needs, blessing us with laughter, joy, and gladness, and of course, dancing to you. Thank you for bringing each and every one from their homes to this place. And thank you, Lord, for your commitment to take them back home safely as well. Lord, we thank you that for 6 years you have faithfully enabled us to have this function of Heroes in Health Awards. We don't take it for granted. We thank you for those who give the finances, We thank you for those who stay awake at night to ensure that the nominees are selected, the preparations are done, the invitations are made, and the place is organized. And we thank you, Lord, for those who come to speak to us from their hearts. Every award that we have received here is a testimony of hard work, a testimony of a life saved, a testimony of a transformation in our health system, and a testimony of your goodness to the health sector, to Uganda, and to Africa. Heavenly King, I pray that you bless all your children here. And Lord, enable all of us to come again next year when you open another door of opportunity. And now I pray that your blessings that come with no added sorrow will be upon each and every one of us now and forevermore. In Jesus' name I've prayed.
All right, thank you so much. A round of applause for our fantastic Honorable Minister, the host. I'm going to ask our Permanent Secretary for the Ministry of Health, Dr. Diana Twine, to join me. I would also ask Dr. Charles Olaro to join me, as well as the ministers from Somalia, as well as, yes, please join me. For this, we're going to start off the group photo, the first one. We're going to have Dr. Diana. If you could join me. Dr. Olaro. Right here. Yes. So we're going to take a picture, group pictures. We're going to start with all the award winners. Every award winner, please come holding your plaque. Please come join us on the stage. Award winners, that's our very first group picture. It will be better on the steps. Photographers, we're going to move to the steps. We're going to flank the Honorable Minister and our Permanent Secretary, Dr. Diana, and Honorable Dr. Jane Ruth, Dr. Lucy CDC, please join us as well. Dr. Olaro, there we go, he's here. And the Secretary from South Sudan, our delegate from South Sudan. The stairs. Go up the stairs, please.